Hey everyone, and welcome to our latest phlebotomy study log. This video focuses on the chapter on routine venipuncture, and I have 31 questions prepared for us. For each one, hit that pause button and see if you can figure it out before I go over the answer. I hope this helps. Let's get started. Number 1. What is the most important aspect of any phlebotomy procedure? It is extremely important to correctly and positively identify the patient in any phlebotomy procedure. Number 2. Describe how to properly identify a patient. To properly identify a patient, match the information on the requisition with the information on the patient's identification band for inpatients, or with information provided by the patient for outpatients. Number 3. What information is typically on a requisition form? Information typically found on a requisition form includes the patient's name, date of birth, the patient's hospital ID number for inpatients, the patient's room number and bed for inpatients, the patient's physician's name or code, the type of test requested, and the test status. Number 4. List the steps you should perform when requisitions are received. When requisitions are received, you should examine them for the necessary information, check for duplicates or errors, group them together for the same patient, prioritize them, and gather all the equipment you will need to perform the collections. Number 5. Define hemoconcentration. Hemoconcentration is an increase in the ratio of formed elements to plasma caused by leaving the tourniquet on too long. Number 6. Name 3 veins in the antecubital area suitable for venipuncture. The 3 veins in the antecubital area suitable for venipuncture are the median cubital, cephalic, and basilic. Number 7. Explain why the median cubital vein is the first choice for venipuncture. The median cubital vein is the first choice for venipuncture because it is large and well anchored and does not move when the needle is inserted. Number 8. Describe how veins, arteries, and tendons feel when palpating them. Veins feel spongy, bouncy, and firm on palpation, arteries pulsate, and tendons feel rigid. Number 9. What techniques can you use to help locate a vein? To help locate a vein, tap the arm, have the patient make a fist, or warm the site with a warm towel or hot pack. Number 10. Define hematoma. A hematoma is a reddened, swollen area in which blood collects under the skin. It can form when the extra pressure from the tourniquet forces blood out through the puncture. Number 11. Describe the correct position of the patient's arm after withdrawing the venipuncture needle. The correct position for the arm after venipuncture is straight or slightly bent, but not bent back over the puncture site. Number 12. Explain the correct procedure for labeling blood tubes. To correctly label blood tubes, label them at the bedside using a pen or permanent marker. The label must have the patient's name and identification number, the date and time of collection, and the collector's initials or identification number. If labels are computer-generated, make sure all the information is present, and then add the collector's initials or identification number. Number 13. List the information a phlebotomist must look for on a requisition slip. The requisition slip must contain the patient's identification or chart number, the patient's last and first names, the patient's date of birth, the physician's name, and the tests ordered. Number 14. Explain the reasoning behind preparing the patient before you wash your hands and put on gloves. Phlebotomists must prepare the patient and then wash their hands so that when it is time to perform the venipuncture, the gloves and everything they touch are as free from contamination as possible. If phlebotomists wash their hands, put on gloves, and then prepare the patient, they may inadvertently pick up contaminants from the patient, which can then be transferred to the puncture site. Number 15. Describe the purpose of an ABN, or Advanced Beneficiary Notice of Non-Coverage, and the phlebotomist's role in their use. An Advanced Beneficiary Notice of Non-Coverage is a Medicare form. The phlebotomist may be required to present it to the patient for his or her signature. It must be presented to the patient far enough in advance of the service that the patient has time to understand its implications and make an informed decision. Number 16. What are the purposes of the requisition? A. Identifying the patient. B. Determining the specimens to be collected. C. Allowing the equipment necessary for the collection to be gathered. Number 17. Which vein is often the only one that can be palpated in an obese patient? Cephalic. Number 18. Upon entering a patient's room, you should first introduce yourself. Number 19. Which vein lies close to the brachial artery? Basilic. Number 20. At what angle should a venipuncture needle penetrate the skin? 15 to 30 degree. Number 21. What information must match on the patient's ID band and the requisition? 1. DOB. 2. ID number. 3. Patient's name. Number 22. When should the tourniquet be removed from the arm in a venipuncture procedure? Before the needle is withdrawn. Number 23. Tourniquets should be placed blank inches above the venipuncture site. 3 to 4. Number 24. What happens if the tourniquet is left on for too long? Hemoconcentration. Number 25. Hematomas can be caused by removing the tourniquet after removing the needle. Number 26. An increase in the ratio of formed elements to plasma is called hemoconcentration. Number 27. Small red spots on the skin are referred to as petechiae. Number 28. If you are asked to perform a venipuncture on an inpatient who is not wearing an ID band, you should ask the patient's nurse to attach a new ID band before proceeding. Number 29. Which vein is the first choice for venipuncture? Median cubital. Number 30. When performing a butterfly draw using a hand vein, you should place the tourniquet on the patient's wrist. Number 31. During the venipuncture procedure, the tourniquet should stay on no longer than 1 minute.
Thank you for watching. Don't forget to subscribe to our channel for more content.